An iconic seaside town. Millions of holidaymakers flock to Blackpool every year to enjoy one of the country's most loved coastlines. But just a few streets away from the Golden Mile, there is real desperation.
All right, welcome. You okay? How are we doing? Sun is shining. It is. How are we all getting on? I'm all right, yeah.
The Amazing Gray's Soup Kitchen used to feed around 40 people a night, but now up to 200 turn up every Tuesday and Friday evening. For many, it will be the only hot meal they'll eat this week.
It's mad in there.
People like James are having to make grim choices. Heat or eat.
I've never struggled like I have done at the back end of last year. I've never had to struggle like that. I've always had enough to get me by. I was wondering where the next couple of quid's going to come from. 2 slices of bread, half a tin of beans, or spaghetti hoops at night time. Bowl of porridge for my breakfast.
Nothing during the day?
Nothing through the day.
He turned his gas off on the 2nd of April, and he doesn't know if he can afford to switch it back on this winter. He's already lost a stone in weight.
It was up to 84 pence for 3 hours instead of 42. So then heating went off. That just stuck an extra jumper on in the evenings when it was still feeling a wee bit cool.
So you might have to go through the whole winter without your gas central heating. You're prepared to do that because that's the only choice you have?
Yes, I'm prepared to do that, just because of the cost of having heating on for a short 3 hours. I've been thinking about this for the last couple of months or so. I'm still sort of swithering.
The centre also provides takeaway food bags, stuff that is cheap to make.
Anything you can use, the kettle, pot noodle, cup of soups, snack pots, tea bags and a drink. So we are giving more and more of these. We have people coming that have got no electricity. They have accommodation but no electricity.
Demand is growing, but donations are falling, both food and money.
So it's quite heartbreaking actually. This is usually stacked to the ceiling, floor to ceiling with food, and as you can see we've got an empty storeroom. We've got literally nothing left.
The centre was established to serve Blackpool's homeless and destitute, but now they're seeing many more low-income families.
The question they're asking is, if it's going to get any worse, what are we going to do? We can't cope now. And we're seeing more and more mental health issues. We're seeing more and more issues around domestic violence in families. We're hearing about people's houses getting robbed for the food in their cupboards. Women that had never broke their law in their lives are going stealing food. We're seeing story after story after story, nightmare after nightmare after nightmare. Things are getting worse and worse by the day.
This growing anxiety will put even more pressure on local mental health services. Christina knows. She struggles with her mental health, but has been told she's on a long waiting list and help is months away.
You could be on the waiting list for 2 years, 2.5 years, before you even get your name read on the register.
That's what you were told?
I've waited 2 years to
for
be
help
seen.
with your mental health?
Yeah, I've not even been seen for 2 years. I've still been waiting.
Christina is battling an addiction to alcohol and drugs. She tells me she would be dead if it wasn't for this centre.
If I didn't have got the right help at the right time, I'd definitely have been 6 foot under. I wouldn't have been here. I wouldn't have lasted another 2 weeks without that help. Came to a bit of crisis point before Christmas, and I've asked authorities for help. I asked the police, I asked the crisis team, rang them up all hours of the night. Not one of them came out to see me. 2 days I was left in my flat. Then Christmas Day, they started looking for me, thinking that I've actually done something. But 2 days they left me on my flat, refusing to help me.
And you told them that
Yeah,
you were feeling suicidal?
Yeah, I told them, yeah, that is, yeah.
Soon, Christina will be too old to use this centre. It's more uncertainty in her troubled young life. More people are dying in Blackpool than being born. Not surprising when you consider it tops almost every league table for poor health. Cancer, heart disease, alcoholism, drug abuse, teenage pregnancies.
Come on, ladies and gentlemen, bring your kiddies, have a go on the old hooker dot. Win a prize every time. You can even add up your points to make a bigger prize.
This is a coastal community with serious inner city problems. If you're a man living in Blackpool, you can only expect to live till you're about 54 before you start having serious health issues. That's lower than anywhere else in England, and it's about 10 years less than the national average. And the picture is almost as bleak for women. These problems are not new, but the pandemic has made things much worse for the town's seasonal economy. Blackpool's tourism sector lost £1 billion in revenue.
Blackpool's broken. We need to fix it. That's not one organisation, that's everybody together.
Karen Brown is a senior nurse who has devoted her life to improving people's health. She tells me Blackpool suffers from imported poverty. That's when people with problems come here because of happier memories made on childhood holidays, for example.
Is it money? It's the skill and it's the desire and it's the passion to get this right for people, and a lot of people have got that, but people burn out. It's relentless. They're just battered at every housing, education, mental health services. I think everybody's just battered at every point.
But where do you even begin to fix Blackpool's problems?
We attract more people with poor health, serious health conditions, and and people who are healthy tend to leave Blackpool for other opportunities elsewhere.
Many people, including council leader Lynn Williams, think you start improving lives by improving housing. Once busy bed and breakfasts are now multi-occupancy bedsits, and many are not fit for purpose.
It's a basic right for people to live in decent quality accommodation and to create that healthier, better well-being, building more resilience to people, and it just creates happier, healthier areas and community, and that's what we want for Blackpool.
That belief is shared by the town's health workers.
There's an age discrepancy of about 10 years, 65 years life expectancy over there in males and close to 80 over there in Stanley, so there's quite a big difference.
Dr. Abida Mohammed is a local GP. Her patients have more worrying problems than their health.
How do we look at accessing secondary and tertiary care when we're worried about our housing, when housing is not decent, when we don't have food on the table, or schooling are not, children are not being given the social support for schooling. So we need to look at all those factors, and that in itself will improve the access to healthcare.
The government says it understands the urgency of the crisis in places like Blackpool, but the people here don't believe it. Christina does not know how long she will have to wait for the help she needs with her mental health. James does not know if he can afford to cook his meals or heat his home. And the queues of desperate, hungry, sick people will grow even longer.